Welcome to the Gastroenterology and Endoscopy Podcast, where we dive deep into the latest advancements in our field. Today, we're exploring a topic that's revolutionizing colorectal cancer prevention, the art and science of polyp reshaping in colonoscopy. Let's start by acknowledging the paradigm shift we've seen in polyp management. Gone are the days of the simple detect and excise approach. Today, we're dealing with a nuanced, multifaceted strategy that prioritizes precision, risk minimization, and preservation of colonic function. Now, let's break down the cornerstones of effective polyp reshaping. First and foremost is accurate classification. We're still using the Paris classification system for polyp morphology, but we've added layers of sophistication. We're now considering size stratification, surface pattern analysis, and pit pattern evaluation. And let's not forget location considerations, because we all know that a cecal polyp presents different challenges than one in the sigmoid colon. Moving on to advanced reshaping techniques, we've got some game changers to discuss. Endoscopic Mucosal Resection, or EMR, has redefined how we approach larger polyps. Whether it's injection-assisted, cap-assisted, or underwater EMR, these techniques are allowing us to remove sizable polyps with reduced perforation risk. And for those of you who haven't tried cold EMR yet, it's worth looking into for minimizing thermal injury in selected cases. Now, if EMR is the workhorse, then endoscopic submucosal dissection, or ESD, is the thoroughbred of polyp resection. It's technically challenging, sure, but the ability to perform en-bloc resection of lesions over 20 millimeters is a game changer. And with innovations like traction-assisted and robotic-assisted ESD, we're seeing improvements in both efficiency and precision. For those really tricky cases involving the muscularis propria, full-thickness resection techniques are giving us options we never had before. Whether it's device-assisted or hybrid approaches combining endoscopic and laparoscopic techniques, we're able to tackle lesions that would have required surgery in the past. Now, let's talk about the future, because it's looking bright. Artificial intelligence is poised to transform polyp management. Imagine having real-time assistance with polyp detection, characterization, and even resection planning. It's not science fiction. It's happening now. We're also seeing advancements in imaging modalities. Optical coherence tomography, molecular imaging, and hyperspectral imaging are offering us unprecedented levels of detail and tissue characterization. And let's not forget about the new resection and closure devices hitting the market, from microwave ablation to biodegradable clips and sutures. Of course, with all these options, choosing the right technique becomes crucial. We need to consider lesion-specific factors, patient considerations, our own expertise, and institutional capabilities. It's a complex decision-making process, but it's what allows us to provide truly personalized care. Post-resection management is equally important. We're seeing advancements in histopathology, risk-stratified surveillance, and complication management. And in some high-risk cases, we're even considering adjuvant treatments. As we wrap up, let's consider the future directions and challenges in our field. We need standardization and quality metrics, long-term outcome studies, and health economics research. We also need to think about how we'll integrate multi-omics data and address the ethical considerations of AI implementation. In conclusion, we're living in a new era of colorectal cancer prevention. The advancements in polyp reshaping techniques are truly remarkable, offering us an array of sophisticated options for managing complex lesions. But remember, the effectiveness of these techniques ultimately depends on our skill, judgment, and commitment to continuous education. By embracing innovation, fostering collaboration, and maintaining a patient-centered focus, we can significantly enhance the efficacy of colonoscopy in preventing colorectal cancer. Every polyp we reshape represents a potential life saved, bringing us one step closer to a world where colorectal cancer is no longer a leading cause of cancer-related mortality. That's all for today's episode of the Gastroenterology and Endoscopy Podcast. Stay curious, stay innovative, and I'll see you next time.